Grief. The American Psychology Association, or the APA, defines grief as the anguish experienced after a loss, usually the death of a beloved person. Grief includes emotional and physical manifestation, and often psychological stress. Signs and symptoms may include anxiety, difficulties concentrating, thinking about the past excessively, and agitation. Grief is the body's method of healing after suffering a loss. Normal or uncomplicated grief is caused by the loss of a loved one through death or ending of a relationship. The time frame will differ for everyone. Most experience grief for several months to a year. Feelings will include sadness, guilt, yearning, anger, and regret. Typically, these feelings will lessen over time because the feelings will decrease in intensity and the individual simultaneously moves forward in acceptance of the loss. Anticipatory grief is experienced before the loss of someone or something. This arises when loss is expected. There will be a display of mental and physical manifestations. Signs and symptoms may include sadness, anger, loneliness, guilt, anxiety, fear, fatigue, and poor concentration. Prolonged grief disorder is known as complicated grief. This lasts longer than 6 months and significant enough that it affects the ability for one to function. Signs and symptoms of behavior are marked by the persistent need to find the deceased person and preoccupied with thoughts of the deceased person. Feelings of guilt or self-blame, anger, difficulty participating in activities, and the detachment from friends or family. Disenfranchised grief. This is grief that is related to not being considered by society as recognized or a justified loss. This is considered by society to be shame or socially uncomfortable and not worthy of grief. Routinely, these individuals are left to grieve alone in silence. This may be due to a loss that is being unrecognized as significant, such as the loss of a pet or miscarriage, an unrecognized relationship, an extramarital affair, an unrecognized griever, a young child, or loss itself being disenfranchised, as in suicide. The Kubler-Ross stages of grief model identify 5 stages within the grieving process: denial, anger, bargaining, depression, and acceptance. Denial is when one refuses to believe reality. They attempt to lessen their pain of the loss. Signs and symptoms are feelings of numbness and shock, the mind trying to adjust, and one wonders how life will continue. Often the individual reflects and relives the time spent with the person and questions how life can move forward without the person. This is the body's way of slowing down and giving the body time to adjust so that the individual will not become emotionally overwhelmed. Anger is the second stage. This is trying to adjust to a loss and feeling severe emotional distress. Questions like why me and statements like it's not fair. It is normal to feel anger. Anger can provide the release of emotional discomfort. Blaming of others can occur with anger targeted at loved ones, which might be family and close friends. Anger is necessary in a healthy stage of grief. More anger will equal faster healing. After the loss, many may feel abandoned and alone. The anger connects to reality and eventually will connect individuals to people once again. Bargaining is the third stage. This is where one attempts a different approach to relieve or minimize the pain that has been felt from the loss. Guilt is a common experience. Depression is the fourth stage. Here, reality sets in. The loss of the loved one is deeply felt. The situation will become real. Signs and symptoms are a feeling of numbness and a sense of immense loss. The mourn of loss and wonders if life is worth continuing alone. Some might withdraw, not wanting to be around others. It is natural and appropriate to have feelings of depression. Acceptance is considered the last stage. This is the point where the individual still feels the pain of the loss, but realizes that all will eventually be well, and acknowledges a new reality. Some days are better than others. Eventually, there's a higher number of good days versus the bad days, and the individual will begin to connect with friends again and perhaps make new friendships, recognizing that nothing will take place of the loss, but that life does go on. The dual process model of grief. This is a process of grieving that shifts back and forth between two various responses. One is loss-oriented and the other is restoration grief. During loss-oriented, during the loss-oriented grief, the grief is conveyed through intense thoughts and feelings. Restoration grief process involves coping with other losses that come with the death of a loved one, as in a secondary loss, as well as rebuilding one's life without the loved one. The time is spent on thinking about the future, and it is a continual shift between the two processes. Worden's 4 tasks of grieving. It is common to engage in 4 tasks as part of the grieving process. For Worden, he believed that 1 is accept the reality of loss, 2 is to experience the pain of grief, 3 is the adjustment to the environment without the deceased, and 4 is to find an enduring connection while embarking on a new life. Death is a normal life occurrence. However, it is one of the most difficult challenges that an individual may face. Bereavement is considered the period of time an individual experiences grief and mourning after a loss. Mourning is an expression of grief in public. It is affected by religious beliefs, ethnic background, or cultural customs. Common grief reactions, these are defined as the person's response to the loss. These may include shock, anger, anxiety, numbness, denial, guilt, sadness and relief when death is expected, depression, disbelief, fixation, trouble concentrating, hallucinations, a tightness or heaviness feeling in the chest or throat that is not cardiac related, nausea or an upset stomach, dizziness, a headache, muscle weakness, tiredness, difficulty falling asleep or staying asleep, a lost interest in consuming food or socializing, and or becoming short-tempered or hostile. There are various age considerations, and the age of the person experiencing the grief will influence their grief response. Death is a natural life event that everyone experiences throughout their life. Infants and toddlers are unable to express their feelings, yet they are able to detect when those caring for them are experiencing grief. They can sense anxiety or distress. Common reactions for infants and toddlers may include irritability, eating or sleeping changes, increased crying. They may become clingy, jumpy or nervous. They may be less active, or they may experience weight loss. The preschooler perceives death as temporary and reversible. They believe that thoughts or feelings that they have can cause death. Preschoolers have the inability to understand that death is permanent. Common reactions for this age group include searching for the individual who died, anxiety, clinging to people, irritability, increased tantrums, trouble sleeping, toileting problems, and changing in their eating patterns. The middle school child, ages 8 to 12, these individuals understand that death is everlasting and recognize the world does not revolve around them. The middle childhood years have increased fears related to death, and these individuals are preoccupied with their own well-being and the well-being of their loved ones. Common reactions for middle childhood will include anger, sadness, anxiety, aggressive behavior, potential difficulty in school. The adolescent, 12 to 18 years old, they understand death and they may respond differently than the adult. The adolescent may have the inability to express feelings that can lead to high-risk behavior. This will assist them in escaping their emotions and reality while they seek comfort. Routinely, they seek comfort from their peers. Adulthood. Bereavement occurs in adulthood and does not occur in other ages. The occurrence of death among loved ones increases in adulthood. Grief is different in adulthood because of the complete comprehension of death and the memories of the deceased. There are various cultural influences on grief. Every culture has its own beliefs, values, behaviors, traditions, and rituals. The cultural influences provide guidelines for how to express the grief experience and serves as a foundation for grieving actions. Spiritual influence on grief, or religious or spiritual rituals, these will assist one in grieving to deal with the death and the grieving process. Often, these may provide support from the faith-based community. Nurses are responsible for providing and delivering compassionate nursing care to clients and their families. Yet, nurses need to remain emotionally balanced. The nurse should provide self-care. This begins for the nurse by performing a self-reflection and an evaluation of their current state of being. The nurse needs to take a holistic view of their life and consider the physical, psychological, spiritual relationships, and their financial status. Once completed, the nurse should identify areas where there exists opportunities for growth and work on these areas. The nurse needs to recognize their personal grief. Grief is viewed through many emotional and physical manifestations, and these can include anxiety, difficulty sleeping, headaches, and joint pain. Most of these findings are psychological. The nurse needs to keep their emotions to nurses keep their emotions to themselves, and not dealing with these emotions can permit, or the nurse will provide less effective care for their patients. The American Nurses Association Code of Ethics states that nurses have a duty to care for themselves as they do to others. They need to preserve their confidence, protect their character and their dignity, as well as continue their personal and professional growth. Compassion fatigue. This is caring for those suffering and injured while sharing in their pain and suffering. Compassion fatigue is considered a cumulative stress that develops from the desire to help those suffering, combined with the inability to relieve that suffering, and this will cause a feeling of professional uselessness and self-blame. Signs and symptoms that may be included are difficulty focusing, feeling nervous, anxiety, disruptive behavior with coworkers, problems connecting with clients sympathetically. There are prevention strategies, and these include reflective journaling, participating in continuing education activities to help restore the mind to balance, and engaging in non-nursing activities to decrease the job-related stress. The acronym NURSE stands for Name, Understand, Respect, Support, and Explore. For name, the nurse needs to identify what the person stated a moment ago. The nurse is identifying the emotion that was expressed. For understanding, the nurse will demonstrate understanding by recognizing feelings and providing an opportunity for the individual to discuss their feelings. Respect. The nurse will voice respect for the individual underneath the circumstances that they are encountering at the moment. Support. The nurse will inform the individual that they are available to them when necessary. Explore. The nurse will ask open-ended questions that will extend the conversation and provide a detailed expression of the feelings and beliefs. For the nursing process with grief, the goal is to verbalize feelings and have a reliable support system for the clients that are served.